What are brain tumor biopsy risks and terminology? When it comes to diagnosing brain tumors, a biopsy is often a crucial step. But what exactly does this involve, and what risks are associated with it? A brain tumor biopsy is a medical procedure where a small sample of brain tissue is taken to determine the type of tumor present. There are different techniques for performing a biopsy, such as a stereotactic needle biopsy or a craniotomy, which is a surgical opening of the skull. These procedures are typically guided by imaging methods like computed tomography scans or magnetic resonance imaging scans to ensure precision in targeting the tumor. While brain tumor biopsies are generally safe, they do carry some risks. One of the most significant risks is bleeding or hemorrhage, which can occur inside the brain. This happens in about 5 to 6% of cases and can lead to serious symptoms such as seizures, changes in consciousness, headaches, vision changes, speech difficulties, or weakness on one side of the body. In rare instances, complications from bleeding can result in permanent brain damage or even death, usually occurring within hours after the procedure. Infection is another risk, although it is less common. Wound healing problems can also arise, and swelling of brain tissue may require treatment with steroids to reduce inflammation. Bruising can occur around the biopsy site or where intravenous lines were placed. Fortunately, most patients recover well, and serious complications are relatively rare when the procedure is performed by experienced medical teams. Understanding the terminology related to brain tumor biopsies can also be helpful. A stereotactic needle biopsy is a minimally invasive technique where a needle is guided into the tumor using a three-dimensional coordinate system based on imaging scans. A craniotomy involves removing a portion of the skull to access the brain for biopsy or tumor removal. Hematoma refers to a localized collection of blood outside blood vessels, which can happen as a bruise or internal bleeding after the biopsy. Hemorrhage is the active bleeding from damaged blood vessels, which can be either internal or external. Neurological deficits are functional impairments that may occur, such as weakness, speech difficulties, or vision problems resulting from brain injury. After the biopsy, a post-operative computed tomography scan is often performed to check for complications like bleeding. The biopsy scar is the healing site after the procedure, and in some cases, it can be associated with seizures. The decision to perform a brain tumor biopsy is a careful balance between the need for an accurate diagnosis and the associated risks. Medical teams evaluate each patient's condition and tumor characteristics to minimize complications. Recovery typically begins in the hospital, where patients are monitored for any immediate issues. Most patients can go home within a day if they are stable. Follow-up appointments are essential to discuss biopsy results and plan further treatment. This information reflects current medical consensus and established practices for brain cancer diagnosis and brain health management. It underscores the importance of professional medical care and individualized risk assessment in brain tumor biopsy procedures. Always consult healthcare professionals for personalized medical advice tailored to your specific situation.